My name is Leah Weisbecker. I'm 40 years old, and I live in Greenville, South Carolina. I have a husband that I've been married to for 15 years and two sons, 13 and 11. I love reading, especially mysteries. I'm a huge Agatha Christie fan. We enjoy spending time as family. I also like to exercise, running to weightlifting to, anything. I enjoy moving, walking with my children. I first started to exhibit symptoms of HAE when I was about a year old. And my mother noticed my arm swelling, and that's pretty much when she knew that I had HAE. As I started to come into my adult years, so it could put me in bed for sure, but I would try to very rarely miss work. I would go to work with a swollen hand or a swollen foot or swollen anything that wasn't too visible. If I had a facial attack or abdominal attack, I'd stay home or have to go to the ER depending on the severity of it. The doctors didn't know what this was. You would go to the ER and they'd want to fill you with epinephrine. We presented as an allergic attack, but it was not treatable, with these methods. And not being understood. I remember the first time I went into the emergency room and I was presenting with a facial attack, and she's like, "You have HAE," and I thought, "Oh my word, you know what this is." It was such a load removed from my shoulders because there was a doctor that knew what I had and was able to treat for it. One of the reasons why it's important to prevent the attacks is I have two young boys at home that I have to care for. I want to go to their soccer and football games. I want to go to their school programs. I want to, be a part of their life. Knowing that I can have preventative treatment that is effective allows me to be able to do those things with peace of mind. The reason for moving to Hagarda was that the doctor said that my C1 INH levels would be more regular. The slow, infusion of the subcutaneous would allow for that to happen, and I wouldn't feel those up and down that I felt on the on-demand treatment previous to that. There was a lot of stress that was relieved. To be able to do that instead of an intravenous application was huge. The wear and tear on your veins is a real thing. I poured through the Hagarda informational material that was sent me, taking note of common side effects. Local injection site reactions such as pain, redness or swelling, itching and rash, dizziness and nasal symptoms, including stuffy or runny nose and sneezing, were listed as possibilities. The way that HAE presents itself in my body, if I have an attack coming on, I get very tired. My energy level goes down, and since starting Hagarda, I've not had to use my rescue medication, although I still have it on hand if needed. One of the greatest messages I can give right now, it's a message of hope. This is one of the things I try to really tell my son, is that we live in a time of hope with HAE. There's doctors' recognition, there's doctors that are knowledgeable in this field.
Now here's some important safety information that you need to know about Hagarda.
Hagarda, C1 Esterase Inhibitor Subcutaneous Human, is an injectable medicine used to prevent swelling and/or painful attacks in patients 6 years of age and older with hereditary angioedema, HAE. A healthcare professional can teach you or caregiver to self-administer Hagarda for prophylaxis. Do not use Hagarda to treat an acute HAE attack once it starts. Work with your physician to plan for attacks if they occur. Do not use Hagarda if you have previously experienced life-threatening immediate hypersensitivity reactions, such as shock to Hagarda or other C1 INH products. Immediately report any symptoms of allergic reactions to Hagarda, including hives, chest tightness, wheezing, difficulty breathing, turning blue, faintness, facial swelling, and fast heartbeat. Before starting Hagarda, tell your healthcare provider about all medical conditions you have, including pregnancy or nursing, a history of heart disease or stroke, an indwelling catheter or access device in a vein, or immobilization for a sustained period. Also tell your physician about any other medications you're taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. High doses of C1 INH have been known to increase the risk of blood clots. Immediately report to your physician or an emergency room if you have any of the following symptoms of a blood clot: pain or swelling of arm or leg, with warmth or discoloration over the affected area, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, rapid pulse, and numbness or weakness on one side of the body. In clinical studies, the most common side effects reported with Hagarda were injection site reactions, pain, redness, swelling, hypersensitivity, itching and rash, dizziness, and nasal symptoms, including stuffy or runny nose and sneezing. These are not the only side effects possible with Hagarda. Tell your healthcare provider about any side effect that bothers you or does not go away. Because Hagarda is made from human blood, the risk that it may transmit infectious agents, including viruses and, theoretically, the agents of Creutzfeldt-Jakob disease, CJD, and its variant form, VCJD, cannot be completely eliminated. Please see full prescribing information for Hagarda, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.